I needed a little bit of distance from my CPE experience to fully appreciate its gift. What I've come to know in that time is that LGH values the role of chaplain in a way that separates us from other hospital systems. It was because of this culture that I was afforded the opportunity to truly be a part of an interdisciplinary team, both on the units in the hospital and in the emergency room. Working with clinicians to provide care that included patients' emotional and spiritual well-being, as well as their physical, deepened my understanding of the importance of caring for the whole person in the aim of healing. What surprised me about my experience were my growing edges. Many of us who are called to a helping profession do so from a place of compassion, and our compassion is born out of an experience with struggle. Well, I knew this in my mind. What I learned from CPE were the ways in which my coping mechanisms, birthed from that struggle, no longer served me. Given my life experience, I kept walls of protection. The walls which once served to protect me from pain and hurt now kept people out. It kept me from the authentic relationships which I craved. CPE taught me that in order to show up for my patients, I needed them to trust me. When I learned how to show up with vulnerability, they felt the invitation to reciprocate. My ability to walk with them was enriched in my willingness to bring my full self to the visit. This flew directly in the face of my previous assumption that chaplaincy asked me to leave as much of myself at the door. The added benefit of this learning revealed itself in my interpersonal relationships as well. My experience in LGH's CPE program made me a better mother, wife, and friend. And all of these things were so valuable to me that I decided to stay, like many of my other colleagues who've gone through the program.